You take the injection. At first, nothing really happens. Then, around 24, maybe 48 hours later, it hits you. A constant wave of nausea. Your stomach feels tight, heavy. Food doesn't feel right anymore. And you start thinking, did I make a mistake? So what is going on here? Is this a bad reaction? Is it your body rejecting the medications? Or is it something you were not warned about? And this is important because this very moment right here is where a lot of people panic. They push through treatment blindly or quietly come off the medication, not because it didn't work, but because no one showed them how to control this part. I am Dr. Almeri, a consultant weight loss surgeon and obesity specialist. And in this video, I'm going to show you exactly why this happens, what your body is doing when you feel this way, and most importantly, how to control it so you could stay on the treatment safely and confidently without feeling like you are taking risks blindly. It all starts with understanding something I call a signal overshoot. So let's break this down properly. So what is actually happening here? Why does this nausea develop after starting GLP-1 medications? First, let's be clear about one thing. Nausea on GLP-1 medication is common. In clinical trials, around 20 to 50% of people reported nausea, especially early on when the dose is being increased. And for many, it does improve over time as the body adapts, but not always. So this is where many people get things wrong, because they assume it will just settle. So they wait, and while they wait, the symptoms continue, and sometimes it gets even worse. And this is important because if these symptoms are not controlled early, this is often the point most people stop the medication. Not because it's not working, but because the side effects became too difficult to tolerate. And in many cases, that could have been even managed better. And that means missing a key opportunity to turn things around in their weight loss journey. So let's break this down properly. This comes back to how GLP-1 actually works. One of its key actions is slowing down how quickly your stomach empties. Food stays in your stomach for longer, and that's not a side effect, that is part of how it helps you feel full for longer. But here's where things start to go wrong for a lot of people. Your system is not used to this, so when food stays longer, pressure starts building up. The stomach stretches, you feel heavy and settled, and that stretching is what we call gastric distension. This is the exact point where the signal begins to shift. Now, normally, that signal will tell your brain, you've had enough, you're full, stop eating. But when that signal becomes so strong, it changes character. It no longer feels like fullness, it becomes nausea. And when it becomes more severe, it can lead to vomiting. This is what I call a signal overshoot. And once you understand this, you stop seeing nausea as something random and start seeing it as something predictable. Now here's another layer to this, because GLP-1 does not just act on your stomach, it also acts directly on your brain, on the part of the brain that controls nausea and vomiting. So even without significant stomach stretching, you can still feel nauseated. So now you have two signals happening at the same time, one from your stomach and one from the brain. And when both are amplified, you get the exact experience that you felt earlier. That kind of wave of nausea. But here is something even more important to understand. The same medication can create completely different experiences in different people. Some people feel just mild symptoms. They settle quickly. Others, they struggle much more, right from the start. Now, this is not random. It comes back to three key factors: your sensitivity to the medication, your baseline physiology, and how quickly that GLP-1 drug dose is increased by your doctor. This is exactly why what works for someone else might not work for you. But here's the problem. Understanding this alone does not stop the nausea. And this is where most people get stuck, because to actually control this, you need to know how to bring that signal back into range. And that is exactly what we are going to discuss next. Now imagine this, you are sitting down to eat. Same meal as usual, maybe a bit heavier, a bit fattier. You've got your phone in your hand, scrolling, watching something. That is quite typical nowadays. You eat the way you always eaten, same speed, same portions, same habits. But what you don't realize is that your biology has changed. And if you keep eating in the same way, nausea will get worse, not better. As you started GLP-1 medications, your system is not the same anymore. Before, your stomach would empty at a certain speed. It can cope with faster eating because food would leave quickly anyway. Even if you overeat, that discomfort will quickly settle as the stomach is clearing everything downwards. But this is no longer the case. So the same habits no longer match the new system. Instead, they will push your fullness signals too far until it turns into nausea that will hit you. Now that you understand the biology behind this, the steps we are about to go through start to make sense. First, do not overload your stomach. Your stomach is now emptying slower. So when you eat the same portions at the same speed, you don't just eat, you overload the system. And this is where the problem actually starts. You think, I didn't eat that much, but your body is thinking, that is too much, too fast. So reduce the load. Eat smaller portions. Eat at a slower pace because the fullness signal is delayed. If you eat fast, you overshoot before you even realize it. Now, this is the moment that changes everything. When you feel fullness is starting, you stop. Not when you are full, because remember, the signal is still rising. So if you wait, it will overshoot, and that's when nausea hits. And this is the part that feels confusing because it feels sudden, but it wasn't sudden. It was building the whole time, but you did not realize it because you were distracted. And let me tell you something very clearly. If you eat while distracted, watching TV, scrolling through your mobile, you will miss that signal. And then it feels sudden. But it wasn't. You just didn't see it building. So you eat without distractions because missing that signal, but even small margins is often the difference between feeling fine and feeling unwell for the next few hours. Now, next layer, if symptoms persist, try to separate food and fluids. Because when you combine eating and drinking, you increase the volume in your stomach. You stretch the stomach more and more, and that amplifies the signal. So instead, create some space. Leave around maybe 30 minutes between eating and drinking. And this is not a coincidence. We use the same exact principle in our weight loss surgery patients because the biology is almost identical. Now you need to be aware of a very important fact. The stomach does not process all food in the same way. Some foods don't just stay, they linger for much longer. And the biggest driver here is the fat contents in your meal. Heavy, oily, fried foods, it slows down the stomach emptying even further. So now you are combining a slowed system with food that are slower anyway, and that's where the signal will definitely overshoot in a hard way. This is why, if symptoms persist, try to shift the type of food you eat into grilled, boiled, oven-cooked, not fried. Try to reduce the fat, reduce the heaviness, and that will make digestion much easier. But even when we do everything right, let's be honest, some people still feel significant nausea. And this is where many people get stuck, because at this point, it's no longer just about adjusting the load. It's about the nausea signal itself. And that is where the medical side comes in. In the next section, we will look into how you and your doctor can build a strategy around the medication that support these changes if your nausea persisted. So now we move to the next layer. Because at this point, it's no longer just about how much you eat or how you eat. The issue now is the strength of the nausea signal itself. And this is where we shift strategy from controlling the load to what I call the signal control phase. The first principle is dose adjustment. And this is where most people get things wrong. They think, maybe I just need to push through things, or maybe this is just part of the process. That instinct is exactly what makes things worse. And this is where a lot of people unintentionally push themselves out of treatment. Because this is not a willpower problem. It is not something you are supposed to endure. This is a signal problem, and signals are meant to be adjusted. So the goal here is not to tolerate symptoms. The goal is to control them, to find your level, your biological threshold, where you get the appetite control with the least and most tolerable side effects. So when symptoms appear, we don't push forward, we adjust early, because waiting too long is what allows the signal to escalate. Sometimes we slow things down, stay on the same GLP-1 drug dose for longer, giving your body time to adapt. Sometimes we step back, drop to a lower dose, let things settle, then build back again more gradually. And in some cases, we might pause the treatment briefly, reset the system, and then restart again in a more controlled way. And this is important. You do not need to reach the highest dose. And this is one of the biggest myths around GLP-1 treatment, that more is always better. It's not. Better controlled always beats higher dose. Because for many people, a lower, well-tolerated dose works far better than a higher dose that overwhelms the system. Now, the second principle is symptom support, because even when you adjust the dose, there is a period where the body is still adapting. And this is where we support the system. And we do this in two main ways. First, we could use anti-nausea medications. They work on the brain, they reduce the signal centrally from your brain. Second, we use medications that work on the stomach, helping it move things through very effectively. We call these medications prokinetic drugs. They speed the flow in your stomach, similar to what we use in medical conditions where the stomach empties slowly, known as gastroparesis. So instead of food sitting, building pressure, it moves, and that one change reduces the signal significantly. Now, you need to be aware that these symptom relief medications are not there to be taking long-term treatment. They are there to stabilize the system while you try to bring the signal back under control. Now, this approach is not just based on my own clinical experience. Multiple prominent research papers have been published over the last few years, which outlined structured algorithms for managing these gastrointestinal symptoms. I have linked some of the key ones in the description below. So if you want to have a deeper look into the topic, you will find the links in the description. Now, this is where everything comes together, because up to this point, it can feel unpredictable, confusing, and out of your control. But when you combine load control through lifestyle and diet with signal control through dose adjustment and symptom support, something changes. You stop guessing, you stop reacting, and you start controlling the process. You move from thinking, something is wrong, to understanding this is how my body is responding and this is how I manage it. And that shift is the difference between struggling and staying in control. And for most people, this is what allows them to stay on treatment without needing to stop. And just to be clear, for a small number of people, even when you do everything right, the signals remain very sensitive. And the symptoms can still be very difficult to control. In those cases, it might be necessary to step away from GLP-1 and look at alternative weight loss strategies. And that is not failure, that is precision, that is understanding your biology needs and working with it rather than fighting it. Now, if you find this helpful and you like this way of understanding the biology first and then knowing how to control it, I have put together a full video covering all known GLP-1 side effects, not just nausea, and how to manage each one properly, because nausea is just one part of a much bigger picture. You can watch that video next. I have linked the video up here. I am Dr. Almeri, weight loss surgeon. If you find this helpful, subscribe for more videos where we break things down properly. No hype, just the biology, so you can understand what's happening and manage it with confidence. If you are already on GLP-1 medication, I'll be interested in your experience. Have you had nausea on GLP-1? Did it settle or did it persist? Or maybe you have had other side effects you want to tell us about. Let me know in the comments. Thank you for being part of the conversation. I'll see you in the next one.